Hi, I'm Jeff Markley, Executive Director of the Northeast Indiana Positive Resource Connection. And to my left is...
I'm Candace Kelly, and I am the Director of Grants, PrEP, and Viral Hepatitis.
The mission of the Northeast Indiana Positive Resource Connection is to prevent new cases of HIV, AIDS, hepatitis, STDs, and to advance a compassionate and stigma-free community response. We serve 12 counties in Northeast Indiana and provide non-medical case management services to people who have HIV. We also do prevention and outreach for anybody needing HIV testing, hepatitis C testing, or other STI infection testing. We are happy to be able to present to you some basic information about our agency, the services that we provide, and some good information about HIV and hepatitis C in general. This is meant to be training for you and to provide you with some good up-to-date information. Candace is going to share some information with you now about our prevention and outreach services.
Yeah, so our agency was founded in 1985, and since that time we've been providing case management services for people with HIV, but also we've been providing outreach services. And our outreach services includes doing prevention educations, staff-in services, HIV and hepatitis C testing, also PrEP navigation services, and then recently we just added viral hepatitis case management services for people who are living with hepatitis C. Within our outreach services department, we serve 12 counties. We serve all of Northeast Indiana, and we are at various sites throughout our 12-county region providing free services such as education and testing.
Throughout this video, you will meet some other staff members of the Positive Resource Connection, and they're going to share with you some of the services that they provide and information, again, about HIV, AIDS, and STDs and hepatitis. We appreciate your interest. We appreciate your support, and if you have questions or you want more information once the video is complete, you'll be able to reach us at 260-744-1144, or you can go to our website, Positive Resource Connection. We appreciate, again, your support and your attention and look forward to providing you some good information and education. Thank you.
Hi, I'm Vanessa Hicks, and I'm the Special Population Support Specialist here at PRC.
Hi, I'm Charity Story. I'm the Director of Education and Testing at Positive Resource Connection. Of the estimated 36,801 new HIV infections in the U.S. and dependent areas in 2019, 69% were among gay and bisexual men. 42% were among Black and African American people. 29% were among Hispanic and Latinx people. 21% were among young people ages 13 to 24. At the end of 2018, an estimated 1.2 million people were living with HIV. Of those, 186,500 were living with HIV, and that attributed to injection drug use. In perfect conditions, HIV can live in a syringe for up to 42 days. In the HIV Surveillance Special Report, it showed among transgender women that were interviewed for the report, 42% were living with HIV. The HIV prevalence rates in urban poverty areas were inversely related to socioeconomic status. The lower the socioeconomic status, the greater the HIV prevalence rate. Many persons who exchange sex face stigma, poverty, and lack of access to health care and other social services, all of which create challenges to HIV prevention efforts. The existing research shows that many persons who exchange sex may have a history of homelessness, unemployment, incarceration, mental health issues, violence, emotional, sexual, physical abuse, and drug use. Some transgender persons may turn to exchange sex because of discrimination and lack of economic opportunities. They may exchange sex to generate income for rent, drugs, medicine, hormones, and other gender-related surgeries. Racism and discrimination HIV stigma and homophobia have a negative impact on the overall health and well-being of African American and Hispanic people. Additionally, poverty and the associated socioeconomic factors, including limited access to high-quality health care, housing, and HIV prevention education, directly and indirectly increase the risk for HIV. Other factors attribute as well, such as knowledge of your HIV status, low percentages of viral suppression, mistrust in healthcare systems, immigration status, and other sexually transmitted diseases. Our harm reduction program focuses a lot on these socioeconomic status factors, and Vanessa's going to talk a lot about what we do to try to eliminate some of those barriers.
Absolutely, especially in the low socioeconomic statuses, it's very hard to reach them. A lot of times there's not a lot of transportation, there's not a lot of just information, and of course medical adherence is very hard as well. So on Wednesdays we do go out and we meet with the underhoused population, so that could be either people who are couch surfing or those that are in a shelter, those that are just on the streets. And we pass out different items such as socks, hats, gloves, feminine hygiene products. We have hygiene wipes now, toothbrush, toothpaste, just anything to make somebody feel decent when they're out and about, and just their own self-worth can help them get a little more acclimated with their health. And so we try to do that. We also offer free HIV and Hep C testing, and so with our testings, we do it out in the public and it's free. It takes about 20 minutes with ours. We do the oral swabs usually for HIV and a finger prick for Hep C. We'll talk a little bit about our different testing methods here in a minute. But with harm reduction, especially with injection drug use, the likelihood of somebody getting HIV or Hep C from sharing drugs is extremely high because that's a direct blood-to-blood contact. And so we do have harm reduction here for our injection drug use right here. So this is an IDU kit, which stands for injection drug use, and this is everything except for a syringe. So this has a cleaning bleach solution. It also has the sterile water, cookers or tins. It also has the cotton balls, tourniquets, basically anything anybody would need for injection drug use, and this is made to help make the gear safer to use. We never say safe, we always say safer. And we have these available here at PRC. Also, there's syringe services program on Tuesdays from 3 to 6 through the Allen County Health Department is where we would refer people out to get clean and unused syringes. And even greatly reducing the risk for HIV and hepatitis C just by allowing them to have that information is something that we also give out for free. Always free information. So when we talk about HIV, we do talk about the risky activities. So blood-to-blood contact, sharing needles or anything sharp from an HIV positive person to the baby, the mom, and then also through sexual activities. So with each of those risky activities, we have risk reduction. And so with the sexual activities, we have typical male condoms. So we have just our regular condoms here. So this one's a snugger fit. We have a larger fit, and then we have non-latex as well because people can be allergic to latex. We also have female condoms, which is non-latex, so it's another good option. And so we pass these out for free as well. We also have dental dams that can be used for oral sex. And then this is flavored because you got to remember anything flavored is meant to be used for oral sex. So that's why we have the dental dams as well. So all of these are available. We also have lubricants. We talk about lubricants being very important, water-based or silicone-based lubricants only when it comes to latex. When it comes to the non-latex, we want to go with silicone-based or water-based only. No oil-based lubricants like petroleum jellies or massage oils. They actually react with the latex and break it down. So these are things that we pass out as well. We pass out the injection drug kits. We also have what we call a smoke and a straw kit. So if somebody is using methamphetamine or crack cocaine pipes, they can get blisters on their lips. So we have these stoppers that they can use, and everybody has their own individual stopper to help reduce that risk of HIV and Hep C from the open sores. We also have in here a tutor snorter straw. So everybody can use their individual tutor snorter straw, and it reduces that risk of HIV and Hep C through the bleeding through the nasal passages there. So we always have a way to do harm reduction. As far as mom to baby, we talk about medications and testing. In Indiana, it's required that all women who are pregnant be offered the HIV test, and then if the case need be to get on medications as well, it's not required. Of course, everything is choice, but if the woman is undetectable, then that actually greatly reduces the risk of mom to baby transmission by leaps and bounds. So also not breastfeeding, because breast milk is one of those risky fluids, and then having a C-section that takes away the vaginal fluids and reduces the blood, which are other risky fluids as well. So the risky fluids, we have blood, semen, vaginal fluids, breast milk, anal secretions. We like to say if it's wet, sticky, not yours, don't touch it. And that really helps get the point across of having to remember universal precautions as well. So universal precautions is treating every fluid, every person as if it has that potential to be infectious. And we usually talk about universal precautions in a first aid situation. So that would be if somebody is bleeding, best way to protect your hands is medical gloves. If you don't have that, any barrier between you and somebody else's wet, sticky blood, the better. Believe it or not, you can put your hand in a condom and apply pressure, and it's going to do the exact same job. We also talk about universal precautions with HIV and Hep C as far as fightings, because that is a risk for blood-to-blood contact. Most people don't ask somebody if they have HIV or Hep C before they get into a fight, but we do like to let people know that these natural openings in our bodies are available here in a fight. So eyes, ears, nose, mouth, open skin is considered an opening as well, which can happen during a fight. HIV can live outside the body for about 60 to 90 seconds. Hepatitis can live in wet or dried fluids for weeks or months, depending on what it is. So again, the blood-to-blood contact, just wet, sticky, not yours, don't touch it. We also like to talk about sharing risk reduction with the injection and drug use. So we talked about that with not sharing the needles, or to make them safer to share by using a works kit with the bleach solution. But we talk about tattoos and piercings as well. Tattoos and piercings, we always recommend going to a reputable shop. They're going to be licensed, because you have to be licensed to tattoo and pierce in Indiana, and they've gone through that universal precautions training as well. So we push you get better work. So the main thing that we talk about is just being informed. If you don't know what the risks are, you don't know how to reduce your risk. And if you do know what the risk reduction is, you can get them at PRC here, no problem.
We like to partner our risk reduction with testing. Testing is a method of prevention. We offer at Positive Resource Connection a few different types of tests. We have the INSTI test. This is an antibody test. It tests for HIV 1 and 2. The good thing about this one is just a small finger stick. We just need a few drops of blood, and it takes 60 seconds for the result. One thing we have to remind people when we do this test is it has a 2 to 3 month window period, meaning it can detect HIV 1 or 2 from the time you were born up to 2 to 3 months ago. So if there's any kind of risk behavior that happened in the last 2 to 3 months, we would recommend that you come back and be retested in a couple months to follow up. We also offer the OraQuick. This one also tests for HIV 1 and 2. And it has the same window period as the INSTI, 2 to 3 months. But this one is nice because we can do it one of two ways. We can do a mouth swab, or we can do just a couple drops of blood off your finger and have the same results. The difference between these two tests, as far as the biggest difference, is it's going to be 20 minutes for this result versus 60 seconds for this result. Another HIV test that we offer is the Determine. This one is different than the other two. It tests for both antigens and antibodies that your body would develop once you contract HIV. And also this one only has a 2 to 3 week window period. So it's a much quicker result and detection rate compared to the other two. This test is typically saved for individuals that have the higher risk behaviors and a possible positive exposure to someone that has HIV. As far as our other testing, Vanessa mentioned that we test for hepatitis C. This is also an antibody test. This is a rapid test like our other HIV tests. It's called the OraQuick. When you test for hepatitis C and you've been exposed, if you test reactive or positive for hepatitis C, we are going to recommend that you go and get further testing. So with that further testing, you would need what's called a PCR or an RNA test. That test has to be ordered by a physician, and that's going to tell if you have a chronic infection or an acute infection and your body has rid itself of that. The great thing with our hepatitis C testing and our HIV testing is if a person were to get a positive result, we're not going to just give them a cold result and say you have HIV or you have hepatitis C, go see a doctor. We have case managers on staff that we can do a warm handoff and we can get them connected to treatment right away. Some reasons to be tested would be if, like Vanessa talked about, if you have ever injected drugs or if you are a current injection drug user, if you have had more than one sex partner, One of the greatest risks would be men who have sex with men and injection drug use. I like to tell people in my educations that if you've never had sex and you've never done drugs, then you don't need to be tested for HIV or hepatitis C. But if you've done any of those, or if your partner, even if you've had sex with just one person, but your partner has had sex with more than one person, that's a reason to be tested. Or even if you're in a monogamous relationship and you've been in that same relationship for a long time and you don't foresee that changing, if you've never been tested in your entire life for HIV, it's a good time to be tested just once to know your status.
And that also goes for STD testing as well. On Wednesdays, we do offer a walk-in clinic. It's from 1 to 5. It's put on by the Allen County Health Department. It's $21 for adults, $10 for students. It is ID and cash only, but that is definitely part of prevention as well, because if somebody has an STD, they're actually opening up their chance of infection for HIV and hepatitis C as well. Typically, those risky behaviors do go one and the same. So that is another way that prevention with sexual barriers can help with STD, diminishing the amount of infections that are happening. But yeah, with our care coordination and our Hep C care coordinator, we can get somebody right into where they need to go very quickly. And then also too, we have a Spanish-speaking care coordinator, and we work with a Burmese translator and also Language Link for those language barriers also. So definitely we try to hit everybody where they're at and give them what they need at that time.
If there's any questions that you or anyone that you work with may have when it comes to HIV or hepatitis C testing or care prevention, please give us a call. We'd be glad to speak with you. Our number is 260-744-1144. We're here Monday through Friday, and you can always reach one of us, me or Vanessa.
Mm-hmm.
My name is Timothy Price. I'm the Biomedical Prevention Coordinator at the Positive Resource Connection. What that means is that I do managed care for people that are using pre-exposure prophylaxis. I do HIV, STI testing, some other medical testing involved with the maintenance of that program. All right, so I want to tell you a little bit about STIs, primarily because what you've probably already learned from high school or some other such thing is shockingly inaccurate. STIs stands for sexually transmitted infections, and it includes a variety of things that are both common and uncommon. The most common ones that we're used to hearing about are syphilis, gonorrhea, and chlamydia. There are a few others: trichomoniasis, Microbacterium genitalium, and others that we don't pay much attention to that are relatively common in our region. Gonorrhea and chlamydia are bacterial infections and treated with antibiotics. They're both curable, completely curable, although there are some strains of gonorrhea today that are a little less easily cured. So, as with any bacteria, we have to continually use new antibiotics as the bacteria finds ways around them to protect itself. So with the CDC recently changed their treatment recommendations for gonorrhea because of some of those resistances that some strains of that bacteria have come up with. At any rate, it's totally treatable and curable, still is, even if you've heard about super gonorrhea. That's mostly just a media headline. So they're both treated with antibiotics, gonorrhea with 2 kinds of antibiotic. The infection called syphilis is similarly treatable with an antibiotic. It's treated with injections of penicillin or a few others if there's a penicillin allergy. Totally curable, however, much more dangerous. If it isn't treated, it can progress to cause symptoms of dementia in the patient, and after anywhere up to around 15 years of infection can cause death. Al Capone died from syphilis. So it's a treatable infection as well, but is dangerous if untreated. The others, if untreated, gonorrhea and chlamydia, can cause infertility and just generally can cause discomfort and scarring and such. But syphilis is the dangerous one. The others, Mycobacterium genitalium and trichomoniasis, are similarly also easily treatable. The Mycobacterium one, MGen, it's for short, is very uncommon still, but it's growing in commonality and treatable with antibiotics. The trichomoniasis is not a bacteria, it's a parasite, and most times when there are symptoms, they show up in women, though men and women both can be infected. And that's also treatable with antibiotics, and relatively simply treated with antibiotics. The important things to know about sexually transmitted infections is that all sexual partners that could or have had sharing of that infection need to be treated in order to contain that infection. It does absolutely no good to treat the one person who's had the test and shown positive if you don't treat all the sexual partners involved. And so oftentimes in our area we have a treat and test program where the person who is known to have had contact with someone who treated or tested positive for one of these infections will be treated and tested at the same time rather than testing and waiting for a result, because it's just better for containing an easily spread bacteria such as that. And I think the last statistics I heard in the state of Indiana, we had something around 47,000 infections per year in just Indiana of gonorrhea and chlamydia. So it's really quite high. So it's important to get that taken care of quickly. One thing that you might have learned in school is that there are certain symptoms: burning when you pee, genital discharge when you have these infections. This isn't necessarily true. It's, in fact, most of the time not true. Only 20% of the time when a person's infected with gonorrhea or chlamydia will you see any symptoms at all. So a person, in order to control that kind of thing, if a person is sexually active with multiple partners, they really should just be tested on a regular basis. That's the best way to control and reduce the numbers of infections. So what I normally tell people is, if you have one sexual partner and that sexual partner is not necessarily monogamous with you, then you should be tested once a year. If you have more than 6 sexual partners, you should move that up to at least twice a year. If you have 10 sexual partners in a year, let's make that 4 times a year. And if you have 15, 20, 50, however many more, let's get tested at least once a month. And that really is the only way to control sexually transmitted infections. We typically set HIV as a separate portion. It is a sexually transmitted infection, but when I talk about STIs, that's not what I'm typically talking about, because I treat ST or HIV as a separate category itself. So I'm going to let the testers, HIV testers, talk about that with you. I'll move on to syphilis. Typically with syphilis, there will be symptoms, but the problem is those symptoms are so not extraordinary that people don't pay any attention to it. So with syphilis, there can be, it's called a chancre. It'll be a hole in the skin that might make one think of a bug bite. It doesn't itch, it doesn't hurt, but it's a hole there. And that's where the syphilis has entered the body. It's transmitted by a skin-to-skin transmission, so it's really not very well protected through the use of condoms. They help reduce, but they don't protect the person from a syphilis infection. So the person who has syphilis might have that where they'll see it, and typically they're going to treat it as a bug bite, so they're going to ignore it. Or there may be a rash, especially a torso rash. Again, it's nothing extraordinary, so people tend to ignore it, because after a period of time, a couple of weeks at the most, it goes away. Another symptom is that there may be a rash or spotted appearance of the skin on the palms of the hands or the bottoms of the feet. Similarly, it goes away so quickly that people don't worry much about it. So syphilis, again, is another one that you would want to get tested for at least once a year in order to be healthy, to have sexual health. But what I do want to talk to you about in regard to HIV is PrEP. That stands for pre-exposure prophylaxis. It's a kind of program of sexual health that is available to prevent HIV infection. And because it also includes regular testing for STIs, it's more than just HIV prevention. It's also sexual health in general. So what it is the practice of taking a medication once a day, every day, while a person is at elevated risk for HIV infection. The medications are, name brands that we use right now are Descovy, Truvada, and cabotegravir. Descovy is still a name brand only, available in the United States. It's rather expensive. It costs about $2,000 a month without insurance. And it's a slightly newer version of the same kind of medication as the original treatment for PrEP, which is Truvada. Truvada now is also available in the United States as a generic, and so even if you don't have insurance and you had to pay out of pocket, it would only be about $35 a month for that prescription, $35 to $40 a month. The third one that I mentioned, cabotegravir, is an injection. It's brand new, just came onto the American market as approved by the FDA. It's a shot that a person gets, and it's only done once every 2 months. And it gives protection equal to the other forms of pre-exposure prophylaxis. The good thing about PrEP is that although those medications can be terribly expensive, in one way or another, a person can be 100% covered. If they have commercial insurance, marketplace insurance, in the United States, those insurances are now required to cover the medications with zero cost sharing. So there's no deductibles, no percentages, no co-insurance. The person should have those medications covered 100%. Now, to clarify that, of course, that means the medication of the three options that the insurance company has chosen to meet that qualification, which almost without exception is going to be the cheap generic. But anyway, it used to be terribly expensive. It isn't now. We also have in the state of Indiana a program that for a person who makes about $50,000 a year, $51,000 a year or less, and is a resident of Indiana, they can get state financial assistance for PrEP that will make sure that whatever their insurance doesn't cover is 100% covered. So they should have zero cost out of pocket for PrEP. And let me give you some statistics about PrEP's effectiveness. It is generally, you'll see numbers anywhere from 94 to 98% given by official publications. The experience in practice is 99.9999, many nines after that, percent effective. Because in 10 years of use, in the whole world, people that have used PrEP as a regular daily practice have had only 4 infections of HIV in the entire world in 10 years. That's astounding for efficaciousness. So we really don't know how to calculate that. There's an estimated 500,000 or so people that we know of using PrEP. Those numbers do not in any way reflect the total number of people that are. But I can tell you that the estimated number of people in the United States alone that could benefit from PrEP and probably should try to benefit from it is about 1.2 million people that would qualify, as it were, to use PrEP. Basically, it's anybody who is sexually active with multiple partners and not having 100% success using condoms. There are other qualifications that are something that would bring a medical provider to the point of recommending it, but I'm not so sure that's exactly the purview of this discussion at the moment. At Positive Resource Connection, we do provide full PrEP service. So when a person comes, we get them hooked up with everything that they qualify for assistance. We make sure that they are hooked up with the right kinds of doctors to help them get the medication. We get them hooked up with medication assistance programs. If they don't have insurance coverage, we can get them hooked up with insurance coverage if they don't have it. And then we do care navigation with them in an ongoing process. So every 3 months when they are due for quarterly testing, then we give them a call. We make sure that they know, they get it set up, and we do all of that testing here on site so they don't have to run around to different places to get it done. We even have a clinic here on Wednesday nights where they can meet with a doctor who will talk with them about PrEP and prescribe. So we really offer everything that's necessary to keep a person on PrEP and to help them surmount any hurdles that there may be in being able to continue that practice. So if there is anything at all that you think I could be of help with, you can reach me at our phone number here, 260-744-1144, or you can email me at timothy@neiprc.org. I'd be happy to help with whatever you think I might be able to be of use with.
Hello everyone, my name is Ricky Rice. I am here at Positive Resource Connection in Fort Wayne, Indiana. I am the Viral Hepatitis Care Coordinator. Once we receive those positive Hep C rapid results, I will go ahead and get in contact with one of our local hospitals here, and we will go ahead and get labs placed into the system so that way we can get the treatment for Hep C started. A well-known fact is over 90% of people can be cured from Hep C in a 3-month time span. At Positive Resource Connection, we have a free program that will assist clients with linkage to care and then also assistance with health insurance. If the client does not have medical insurance, we will link them to a healthcare navigator that will assist them with Medicaid and also marketplace options. We will continue to find any resource possible so that way we can make sure that the Hep C treatment is inexpensive. While enrolled in the viral hepatitis program, we will develop a plan of action to assist that client with personal goals and also treatment goals for Hep C. Once treatment is over, we will maintain that relationship with the client to make sure that they get tested every 3 months to avoid the reinfection of Hep C.
So as Ricky mentioned, as far as his program and the viral hepatitis C case management program, basically if somebody were to become reinfected after they've been virally cured, it would be not a problem for them to re-enroll back into our program, and then Ricky would follow them through that process of getting them into medical care, getting them on insurance if that's lapsed, and then helping them get to the point where they're again virally cured.
One of the biggest misconceptions about Hep C is that while you are an active ID user, you still can be treated for Hep C. What I would like for people to know is that regardless of your status, you can receive help at no cost, no judgment. We are here to help, and my name is Ricky, and you can reach out to me at 260-744-1144.
Hi, my name is Rachel Hansen. I'm the Director of Client Services at Positive Resource Connection.
And I'm Lauren Walters. I'm a non-medical case manager at Positive Resource Connection.
So our agency is the only agency in Northeast Indiana that provides services to the 11 county area for people who are living with HIV or AIDS. We offer a range of services, and they include counseling, housing support, non-medical case management, and also support groups.
I assist with a lot of our support groups, and we meet twice a month, sometimes 3 times a month for an informal lunch, and that really helps our clients be able to have a safe place where they can talk about serious or not so serious things going on in their life, and for many of them it's the only place that they have where they can fully be out and be themselves.
We also offer individual counseling for clients who want it. We have various options. Some are in person here at the office, and others are via telehealth or other programs outside of the agency we also refer to if that's appropriate for the client. And then we also offer housing support, whether it's long-term or short-term. It depends on what the client is eligible for. We have a housing coordinator that would meet with them to determine their eligibility for housing assistance, and it's based on whether or not they're a client here, their income, and other factors that the housing coordinator would go over with them.
So we also assist with getting clients linked to medical care and essentially getting them onto HIV treatment. Usually it's 1 pill once a day that they can get onto. And we work with a clinic at our office once every other week. We work with doctors in the area. We make applications for patient assistance programs to help clients afford them. We assist clients with applying for insurances. We just do anything in our power to get clients onto medication, which is ultimately to get them undetectable so they can't transmit the virus to anyone else.
So the main goal of our job here when we're working with people who are HIV positive is, as Lauren said, to make sure that they have access to medical care, insurance, and treatment. Most people who are positive are able to take one pill once a day to help treat their HIV. Some regimens would include more medication than that, but for the most part, people are on one pill once a day. We work with doctors in the area. We have a clinic here, all things Lauren said, and that really just helps people to stay healthy. With HIV, you can live a long, normal, happy life, and your life expectancy would be about the same as anyone else's.
And one treatment option that we didn't talk about was, depending on your health and how you react to the treatment, there is a once-a-month shot that is going out in some doctors' offices as well.
So the clients that we work with, in order for them to be a client here, they have to be HIV positive, they have to be a resident of Indiana, and we have to enroll them in a program through the Indiana Department of Health known as Ryan White Part B. Other than that, they are eligible for our services if they're enrolled in those things and meet that criteria.
Despite HIV being so easy to treat nowadays and HIV being more well known in the community as not being a death sentence, there is still a lot of stigma and discrimination that we see as professionals and as people who have loved ones with HIV.
We do still get a lot of reports from clients about their status affecting family matters, their employment, their housing, even sometimes medical providers not totally understanding HIV in its modern context. So clients still definitely face stigma and discrimination based on it. And a big thing we try and do is educate our client on what HIV is so that they can help educate the people around them if that's a possibility for them. And then other departments in our agency are certainly working to help educate the general public about HIV today and what it looks like, and try and destigmatize that for clients and others.
There are only 4 ways to transmit HIV to another person, and that's through blood, contact, semen, vaginal fluids, and breast milk. Yet a lot of people still think that touching a person, kissing a person, sharing dishes with a person could give them HIV, and that's just not true. And those are some instances of discrimination we've seen with our clients, where family members might not want to share the same dishes with them, might not want to share the same bedding with them. And as a professional working with clients who might have HIV, if you ever have questions about how HIV is transmitted, or if families have issues, you can always have them come to us for assistance as well with a better understanding HIV.
We've also seen some clients who have the question on like their pre-employment forms about any health issues that they may have, or their status has been disclosed as part of a pre-employment physical or things like that. That is all stuff that shouldn't be happening. Clients are not required to disclose their status to just anybody. The law is pretty clear that it's if you are epidemiologically proven to transmit the disease is the only time you would need to disclose that to somebody. And Lauren talked about what those routes of transmission would look like. Otherwise, you do not have to disclose your status to anybody. So we do have some resources as well for clients if they feel like they've been discriminated against based on their HIV, or have had issues with things like the pre-employment questionnaires and things like that that would ask about their HIV status. If you're enrolled in Ryan White Part B, you are eligible for legal services through the Indiana Department of Health, and that could help in addressing any issues we have with clients whose status has been disclosed without their consent. Some of the other programs our agency offers includes like food assistance, as well as assistance with transportation to medical appointments. We do have several food programs here. We have an internal food pantry that clients can use once a month if they're eligible, as well as what's called a MAC food program that is through MAC Cosmetics, and it helps people who have low weight or wasting syndrome to get more food throughout the month that they need. And then we also have a contract with Meals on Wheels and are able to refer clients to that program if they are in Ryan White Part B to get food weekly.
An essential part of our services is transportation, because one of our goals is to make sure our clients are obviously healthy and going to their medical appointments. So we have partnerships with Uber Health. We assist clients who might not have any other means of transportation with that. We offer bus passes, and we also work with CTN transportation. And if clients have programs like Medicaid or HIP, we can help do referrals for transportation through their insurance as well. And we have gas cards for clients who are out of Allen County, who might have difficulty driving far distances.
So one thing we always just want our clients to know is that they can live a long, healthy life. Their life expectancy is just the same as anyone else's, as long as they're involved in treatment. So if you know anybody who could benefit from our services, we are here to serve Northeast Indiana, and anyone who is living with HIV and a resident of Indiana is eligible for our services.
I want to thank you for watching this educational video and hope that you've learned some new things today. The things I hope you will take away are the fact that if somebody is HIV positive and they know their status and they're linked to medical care, taking the medication that they need, they will reduce the viral load in their blood system to what we call an undetectable level. And that means two things. It means they will not go on and develop AIDS, which is incredibly wonderful for them and the community. But also, that person is then unable to transmit the virus to anyone else. This is one of the ways that we are going to reach an AIDS-free and HIV-free generation. You also learned about PrEP, and PrEP is our other big tool in the toolbox in prevention. Individuals who are taking PrEP and taking it as they should also become unable to become infected with HIV, even if they're engaging in activities that might otherwise put them at risk. So take those two pieces of information with you, help share the word about what we do, and help us advance a compassionate and stigma-free community response to HIV, AIDS, hepatitis, and STIs. On behalf of the staff of the Northeast Indiana Positive Resource Connection, we all say thank you.